And so we'll quickly continue to our journey of talking about some diuretics. So yes, this one is known as what Dextran. Right? Some people simply call it Dextran 40. Dextran or Dextran 40. Let's talk about the pharmacology of this drug. So coming, this Dextran is actually a polysaccharide and actually acts as what? A plasma volume expander. Right? So mechanism of action actually increases what? Blood volume by drawing fluid into vascular space. So this will now increase blood volumes and helps to maintain adequate tissue perfusion, right? So it also has some antithrombotic effect. So it reduces what blood viscosity, then promotes blood flow. You know, thrombus is the formation of clots. So antithrombotic, it will what prevent clot formation. So it will reduce blood flow, okay, reduce blood viscosity, promote blood flow, then also decrease the risk of clot formation, right? So for its absorption is administered intravenously, so it's ensuring rapid onset of absorption. Distribution is what mainly in the intravascular space, so it's basically what expand plasma volume, right? Dextran. Metabolism is liver, excretion is primarily through the kidneys, right? Clinical use used for treatment of shock, so it's used for adjunct treatment of shock due to hemorrhage, burn surgeries or traumas and all of that. Also a prophylaxis for trauma, for thrombosis. So you want to prevent possible thrombosis. So deep vein thrombosis or pulmonary embolism in patients that have a risk of developing those conditions. Okay. Then adverse effects, sometimes it could lead to what hypersensitivity reactions. Then because it is stopping clot formation, it can now tilt you into bleeding. Do you understand? Then renal dysfunction, right? Renal dysfunction. So precautions is that's where you should take cautious, right? If somebody has renal impairment, you don't use this drug, right? So use cautiously with patients that have renal issues due to what the risk of osmotic nephrosis and renal failure. The coagulation disorders. If a patient already have coagulation disorders, don't use this drug on them, right? So that's the pharmacology of what Dextran.